Good morning, everybody. We're just waiting another couple of moments for more people to join us. And here we are, just after 10. So I'm very pleased to introduce Ted Maddox from Adult Care Services Community Wellbeing Team to talk us through the relaunch of the Community Opportunities and Day Activities Fund. So, Ted.
Thank you, Helen, and welcome everyone. Thank you for making time early on a Monday morning. Thank you for your patience, but we had to pause and restart this process. Obviously, COVID got in the way. Bit of housekeeping. You're all muted and we can't see you either, so it's no good waving. But do please put any questions in the chat box and we'll come back to them at the end if I haven't answered them during the presentations. We are recording the webinar, so we'll send around a link to that and another look if you wish. Brilliant. So the agenda today, we've only got an hour, so we'll go quite quickly. Those are the things we're going to talk about. And I think I'll just move on to the next slide, please. Brilliant. So you probably know we've been talking about this for years, trying to find a better way of recommissioning the range of activities that people do during the day. That we've also not found a word for all of it, apart from day opportunities, which doesn't fit greatly, but it's about day services, day care, day opportunities, daytime activities, and of course I know some of them are in the evening, which is part of the problem. But I think you know who you are. Also provide workshops around the end of 2019, just into January, I think, as well, and then of course the pandemic hit. We fed back from those workshops to ACSMB board. They were very pleased that we've been able to hear from you about your feelings. And they agreed that a grant process was the best way of going forward. Now, the great things about grants rather than contracts is they allow for conversations. It's not a all or nothing closed book sort of thing. We can talk to you while you're bidding. You can talk to us, ask further questions. Even once the bids are in, I'm sure we'll have further questions to ask you, which is something we can't do when we're tendering, contracting. I know that tendering processes are very onerous, and unless you're used to them, they can be quite a headache. So we hope that a grant process will be much more user-friendly. When we talked to you at the end of 2019, we were talking about two choices, frameworks or grants. Frameworks are for people who are Care Act eligible. So they're people who are entitled to ACS money on their own account for their own personal needs.
Oops, sorry.
We've lost you, Helen.
Sorry.
That's all right. That framework process was carried out by my colleagues, including Gemma Brace, and it's completed now. So some of you may have applied and been successful. That would mean that you could have a grant for people who are below Care Act eligibility from us. And you might also have some people on the same day who are getting individual funding under the framework. If you decided that wasn't really for you, that's fine, just forget about that. But it's possible that process will be opened after a few years, still talking that through with our procurement legislation people. The services that will be eligible for this round of grants are those which are preventative. So as I say, below Care Act eligibility, aiming to keep people well enough not to need statutory services. Oops, I've lost you a bit. So maintaining, improving independence. Do have a look at our Connected Lives framework. You'll find it if you Google. And we're at the stage where we're talking about connect and prevent. So those services, again, that are open to all. That's what we mean by universal access. So you decide who can benefit from your services. We don't tell you. The services need to be inclusive. Oh, could you go?
Oh, sorry. Beg your pardon.
Yeah, so you might want to focus on a particular part of society, a particular ethnic group. But you shouldn't exclude anyone. We want services that are open to all, even if they've got particular benefits to people with particular interests or backgrounds.
I'm just going back. I had a slight technical issue.
We're not aiming to meet the total costs of the service. It's about those costs which are specific to the vulnerability of the people you're helping. They might be around staffing, specific venues, or the ability to make something affordable that otherwise wouldn't be, but is needed because of a particular group with particular specific needs. So we're not aiming to fund general clubs for helping people with no needs. This is about helping people who have some sort of emerging needs. If you applied last time, we will have saved your applications, so we can open them up to you again. You can revisit them. You can. There's nothing fixed about that. A bit more on the previous slide. Sorry, Helen.
I'm sorry. Oh, excuse me.
That's good.
No, it's not. I'm just.
It's jumping around a bit. I'll just go on and on.
Oh.
You'll need to have links with the community that you're working in. We don't sort of bust to a centre somewhere and then bust home at the end of the day. It is about helping people connect with their communities. If you're not sure about any of this eligibility, do give us a ring or an email. Don't go away thinking, well, Ted said it wasn't for me, because I might have put it badly. You might be doing something slightly different, or you might be a slightly different sort of organisation. But do check with us before walking away. So we're looking at things to keep people in contact, reduce isolation, provide breaks and peer support, so carers themselves have particular needs. We want to see defined outcomes, and we want to know how to measure them. We may give you some sort of overarching measures, but really it's down to you at the end of the day to say what you're trying to achieve and how you're going to measure it. You can choose which sections or what sort of needs you want to meet. We're particularly interested in services which can meet a range of needs, particularly where there's perhaps very rural communities where there isn't enough demand for more specific services. We might like to see more general services. We don't have funding for services which are specific to mental illnesses, particularly diagnosed ones. We do expect all the services we fund to their bit to improve people's well-being and mental well-being. But if your service is specifically for mental health, we'd invite you to have a word with our colleagues in mental health commissioning, and we can put you in touch if necessary. Apart from that, we have got funding for services for older people and adults with disabilities. We'll need you to show why you think your service is needed. That might be about your local demography or the demography of the wider area. It might be about the isolation of your location or deprivation. There's a list of places you might look for that sort of information coming up, but you don't have to write an essay on that. We don't need a research paper. Just let us know why you think your service is needed and give us a bit of evidence around that. Next slide, please. So we're looking for not-for-profit organisations. That might be registered charities, CIBs, others. No one with shareholders. If you think again that you sort of fall between stools, do check with us. If you're going to do that mixture with the framework funded individuals, you need to tell us what sort of mix you're going for. We may well ask you for names to ensure that we're funding people through just one route. And we'll want you to explain how you'll make sure of that. Going back to demand a bit, you might need to tell us about how demand is changing.
Sorry.
You might be able to say, if you're an existing service, what demand looks like at the moment. If you're not existing service or you want to grow, you would need to tell us about why you think there's demand for that. You might want to tell us about the impact of COVID. So there might be some months, or the grants will start in April. There might still be some time when you're having to act on reduced capacity. We hope not, but who knows? So you might want to tell us about different costing models, one with a reduced capacity to COVID restrictions, and another for sort of maximum capacity. You might also want to tell us some additional costs that you perceive due to COVID, and tell us about how that might affect demand going forward, and the extent to which people are confident about getting back to normal and getting out. Next slide, please. So you'll need to give us a number of things, some but not all of them are much more details in the application document. It says they're recent accounts. We're happy to talk to organisations that don't have bank accounts, but we'll probably ask you to talk about another bigger organisation that could act as a sort of parent company or someone who could hold an account for you. We certainly don't want to exclude the smallest organisations, but we do need to be able to demonstrate how money is flowing. A number of policies and details of insurance. If you're stuck with any of these things, again, do come and talk to us. Next slide, please. So we've still got the budget we had a few years ago. We're hoping to sort of scrape in a bit more. We're not quite sure what the government are going to come up with in terms of COVID funding. They seem to not have a great deal of planning around that, but it'll be at least as much as it was. We'll be funding for a set number of places rather than for individuals. So tell us your total capacity, and do tell us also how many people you expect to come, maybe more than once a week. So number of places in a week and number of people you expect to see in a week, because that could well be different. We may not award you the full amount. We need to make sure that we've got equality across different service groups, across geography. We need to make the money go as far as possible. So we reserve the right to come back and say we can offer this much and talk to you about whether that's still something that can do something meaningful. We expect there to be a reasonable charge to users. We certainly don't want to include transport in this because that's a separate issue. We don't expect to pay for food. Venue costs are tricky. We can't exclude them, but we expect to see some contribution to that. As soon as I put a figure to it, people will say, well, that's what you said, or you said that's the maximum, or you said that's the minimum. If it was in the range of £5 to £10 for a day, we'd be less likely to ask questions. If it's outside that range, we might be more likely, but I know there's a vast range in what you do. Some of it's half days, some of it full days. Sometimes you have people come in to do sessions, which costs a bit more. So again, it's a bit of a case of talking to us, but we want some equity across the board. We don't want to be funding services at different levels with people contributing very different amounts, because that's not really fair. The grants will be for 2 years. Our board have said we can have an option to extend a year, providing funding is still available. Again, nobody quite knows what the future holds, but we hope to offer that 3rd year. We'll probably talk at that point about how successful your services have been, whether they're overheating or quite as busy as you expected. Next slide, please. I think I've said a bit on this, but really, yes, to go back, you work out what you're trying to achieve and how you're going to measure it. I'll probably ask you for some sort of top level measures. What we don't want to hear is they all thought it was nice. It's got to be about how you've helped to maintain independence, reduce isolation, keep people fit mentally and physically, and keep them safe and well. So something that measures that is what we're after. Next slide, please. I'm going to hand over to Helen now. Thank you.
Hello. Well, apologies for the exciting slides backwards and forwards. I've got a bit of a resource issue. A lot of what Ted has said, everything Ted has said, is in the guidance notes, and you're also going to be getting these slides. So we've updated the guidance notes a little bit, particularly to take into account of the fact that we've had a 2-year hiatus. So the website is there, but in case we've got any really interesting questions that we need to feed into the guidance, we're going to open it for applications later this afternoon, because we thought this meeting would be quite important. So have a look later today, and you will get emails. So really importantly, I know lots of you have already started, some had even finished before we had the pause in March 2020. So you obviously don't want to have to go through all that again, but what we'll do is email you a link to your old application, your started application, your in progress application, with some instructions about what you need to do next, so we can reset them to unsubmitted. And there's just in case you want to review it, because things might have changed. And also there's an additional question we're going to ask you about the pandemic. We're also going to ask you to include a spreadsheet which has a breakdown showing if you are running more than one service in more than one location, many services across an area, so that you can list them separately. So it's really clear then how they're costed, and how many places or people are going to be met with your service. Very happy to discuss this if any of it's not clear when you get your email. If you're starting from scratch, that's absolutely fine. The application form will take you through what's needed, and there are guidance notes integrated into the application form, and then there's very long guidance notes as well alongside it, which include all the criteria that Ted has mentioned. So that's starting this afternoon. There's nearly 6 weeks to do your application form and updates, and hoping that you will hear by Christmas what the outcome is. Very importantly, that gives quite a long lead time for people who are currently funded by contract, if there are any adjustments at all. So there's plenty of notice before the services have to start in April 2022. So I don't know if Ted wants to say anything about what might happen if somebody doesn't get any funding that they were expecting, in terms of working with unsuccessful bidders or pointing to people to other sources of funding. Of course, we've got sources of funding besides this one at HCF, which is always useful, and we're more than happy to advise and redirect.
Yeah, so hopefully there won't be any sort of sudden surprises, because we'll be talking to you as you go along. There's nothing I'm aware of out there that I don't feel is useful in some way or develop a degree. So, but there may be people who have a different sort of funding, different level of funding, and it might be necessary to talk to users about different levels of contribution or different models of delivery. So 3 months to talk that through.
Yes, which is helpful. The lead time wasn't as long the first time around, so that's quite helpful. Also mindful of the fact that there's such a huge range of services being applied for, from very small grants for one activity to much larger grants for a huge range of activity. We have one application form that needs to fit everybody. So if anybody has any concerns or questions about the application process, just drop us an email and we'll talk it through with you. There's also quite a long time after you've applied, when the deadline comes, for us to come back to you if we need any more information, or certainly talk to you. So if you are offering more than one service, we will ask for a spreadsheet showing details of what other services you're offering across the board, you know, if you've got a huge portfolio or even a moderate one. So it's going to be sending us what's appropriate and what's proportionate. And if we don't get what we want from you, we'll ask you. And if you're not quite sure what to send, you can ask us. There's also going to be another sort of drop-in webinar session a little bit closer to the deadline in early October. So we can have another session. And any questions that are asked today, we will answer and put in our FAQs if they're new. And anything we haven't got time to answer today, we will answer separately and put in our FAQs. We're going to keep that as a live document on our website with anything that comes up in conversation that might be useful to other applicants. So that is the plan. Let's see. Oh, here we go. I think we're on to panel questions. And once again, apologies for slide problems, but you will all get a copy of them. And if you want us to revisit any of them now, we can. So who will be on the evaluation panel? That's in our guidance notes. I can answer that one. That's the first question I've noticed. It's on the evaluation panel, it's members of the community wellbeing team and members of HCF that gets discussed, but the ultimate decision is with Herts County Council, where the panel recommendations will be approved. There's a question about charging, which Ted, can you see that question, Ted, about do services have to be charged rather than free? I don't know if you want to answer that one.
To users, let us know why you think it has to be free, and probably needs to be more than it always was. There might be special circumstances or people in special circumstances themselves where it might be reasonable, but let us know why you think that's necessary to be the case. You'd expect some contribution in order to make the money go further, for fairness, as I say, and it can make people feel a bit more sort of invested, a bit more likely to come rather than drop out on the day. If you're a hospice, that's maybe the argument that you want to put forward, as I see in the questions there. The other thing is around carer services, which HCC expect to be free. That doesn't mean that everything on the day has to be free for carers, so there'll probably be a charge for lunch or materials, things like that.
And also in your application, if you say what you're charging for, you can say clearly whether people are paying directly for their lunches, for example, and therefore not relevant to the grant, or whether what your charge is for the service that you're asking for the grant for. So this is a contribution. And Ted's comment about free services, we've noted time and time again that if activities are completely free, depending on who they are, of course, often people don't turn up. But it depends who you're talking about. You might have a different group of people in mind who couldn't afford anything. What else have we got? Where can you find the guidance notes? They're all going to be on our website, which the link will go out with the email that's going to send you the slides later on today. So it's on our HCC grants page. That's quite easy to find, and the guidance notes are there, as well as a link to the application form. But give me till the end of the day to make sure we've reflected a few more things in the questions here, but it will be ready by 5 o'clock for you to have a look at, and we'll keep the FAQs updated on there. Oh, look, somebody has already put them there. That's super. Thank you, Danielle. And they are there, yes. Oh, question from Sarah about being a hospice and all their services being free at the point of use.
Yes, it doesn't exclude anyone, but we'd like to understand more about why things are free, and that sounds like something we'd like to. So I don't want anyone to go away from today and think they're counted out. Do check with us, but that certainly doesn't count you out. There's a question about, we operate a range of different services, but this evolves and changes over time. Yes, we'd encourage that. You might well need to respond if it's in response to the wishes of the service users or their changing levels of independence, that's absolutely fine.
What else have we got?
Question about funding continued to 31st of March. Yes, if you've got a contract at the moment, I'm aware we've just extended most of you till 31st of December. We will need to extend that up to 31st of March to cover the gap, but I need to get board approval before I actually put pen to paper and send out letters. So we'll get on with that as quick as we can.
I've just spotted Juliet's response to free services in relation to hospices. Yes, of course, hospices are like national health free at the point of need. And I don't know if you're caring for someone at a hospice, whether that counts as preventative service, unless you were thinking of one of your other services. Rather than primary care, Ted.
Yes. We're not looking to provide health services. That's really hard to define. So I think come back to us and check. I know that hospices do befriending services, which are quite separate to anything clinical. So yeah, if in doubt, get on the email to us. That's brilliant, thank you. Couple of questions about the initial 2+1. Obviously, we'd hope to carry on. We haven't got a guarantee of funding yet, and it times might be quite hard in the future, although there might be extra money for social services, depending on how you interpret the new tax. We would be looking to open with whatever cash we've got. We'll need again before the end of the 2+1 in order to give people again to bid. So have a go then if you're not ready. If you want to try something in between, do look at the other funding on HCF website, and particularly the crowdfunder page, where we're able to do a little bit of top-up funding in certain circumstances. So if you've got a good idea of something, you're not quite ready to go full-time yet, then have a look at those grants and the crowdfunder page. Apologies to people who put the first questions in, we're sort of doing them backwards. I'm going to go back to the start. So we're done with the grants reopen, hopefully. Funding, yeah. We've done the panel. And we've done guidance notes. So we're part of a national charity. We operate as an independent region. Policies set by head office, independent bank account chair and treasurers. Yes, certainly you can apply as a local organisation, a franchised organisation. If you're acting under national policies, then those are to see. But if you want to use your local bank account. I think we've answered all the questions that are there so far, but if we haven't, then just type in again. I think there's one in Q&A. That's the same one. That's brilliant. So I should have been clear at the start. Some of you are typing into question and answer chat. That's absolutely fine. We'll look at both. If there's anything else that anyone's doubtful about. So the other good thing about grants is you're not directly in competition with each other. You're not, there's not just one winner. So you might want to share information with each other if you're feeling generous, or work together on things. You might be able to look at a particular locality and say, well, the best thing we can do for our people is operate here and someone else's service somewhere else, just down the road. We would be looking for efficiency and effectiveness. So I want 10 identical services in one centre of one town, unless you can prove it's a particularly needy area.
And you are going to be looking at geographical spread and trying to map onto need.
Yes, geographical
On to
needs
you.
and different service groups. So we don't want any particular part of the community to get more attention than others, whether that's geographical or personal needs, types of disabilities, that sort of thing.
Somebody's asked, Elizabeth has asked if they have to be a care provider to apply. Not specifically.
No, certainly not, no. And as I say, we're not looking for Care Act eligible care. Registering for care providers has always been a tricky thing in daycare. We're certainly not expecting people to be registered. You may do personal care without being registered. You may do personal care and still be eligible for this if you're not taking people on sort of individual placements. We may ask you why that would be a more suitable way of providing your service if it does seem to be Care Act eligible. How would we know if another service is applying? I think that's where it's really worth talking to your neighbours and your peers. It wouldn't cut you out. It might be very different things. I know that some of you are able to move into helping people with some levels of dementia, others line at a different point. So you are all very unique. But it's worth being able to say, I mean, it won't do any harm to say we've talked to our local peers and neighbours. And this is why we think this is needed. I mean, it would be hard for you to say we need a whole new service without reflecting on what's already in the patch, or that we need to grow our current service. Will the price per hour be comparable to the day opportunities framework? This as a lower rate per hour. There's not really any read across. We're not looking at a price per hour. We're looking at what you need to make the thing doable. So as I say, it might be about salary. It might be a little bit about venue. We're not looking for you to come up with a rate per hour. It's more of a rate per service, which you might then say, well, we'll need this much per day to keep it running. But certainly not paying on a cost per case basis in the way that the framework does. It's probably going to be quite hard to talk about demand with COVID having affected people's confidence so much, but if you can do a bit of research into your users and talk to them about how happy they are to come back and what sort of numbers they'd be comfortable meeting with, that would be very useful.
It's asked about a minimum size of grant, and there isn't one, is there?
No, there isn't. Again, obviously, quite small is quite welcome because we can make it go further. And that's another good reason for a grant. I mean, there won't be the same costs to us in terms of monitoring and capturing figures. There will be monitoring. We will be talking to you during the life of the grant. But because it's a thing that doesn't have so many overheads for us, we're not concerned about how small the grants are. They would be for going service. So if you just want some tables and chairs, do try one of the other grants on the HCF pages. This is about 2 years of costs. Good question there about variable charges. Yeah, I know a lot of people have sliding scale, and that's very welcome, and do tell us about how you plan to do that. Some people may not charge, some people if they're in particular financial difficulty. That's fine, let us know about it, but also let us know how you'll be helping people to maximise their income if that's the case. Would there be a place for consultants from complementary services? Yep, that'd be very welcome. That would very much demonstrate partnership.
Likewise, there's a question about maximum grant size, and no, there is not a maximum grant size. It depends on the number of services and people involved.
Yes, again, and some of you will be bidding for multiple locations. We'd like to hear about the separate costs if they're different. It may be that we're able to find one of those locations, but not another. Or we might have to deal with them differently. You know, you don't have to put in a dozen different bids, but do show us how your things break down across different localities. In terms of maximum bids, we don't want to give it all away to a very small number of people, but do, as a starting point, put in what you need.
Oh, there's a question from Fred Preston saying, we make no charge for our services, but ask for donations as clients can afford. Is this allowable? We'd have to know a bit more about the service, wouldn't we, I think?
Yes, and how it all stacks up. And again, back to fairness. So it needs to be fair when we're looking at other services which do charge. You might guide donation or guide level. We'd be interested to hear how you work out what, and we'd be interested in your sort of history of how much that's helped the balance. If it's covering virtually all your costs, it sounds like quite a good idea. If it means that we're having to take money from another service where people are making regular payments, that probably wouldn't be so comfortable.
What else have we got? Any more questions that we haven't seen? Let's have a look. I think that might be it.
Sorry, there's one in chat. Can grants go towards salaries? Yes, that's very much what we want to focus on, is that staffing which is needed because of people's vulnerabilities. There are probably a million clubs out there that run themselves quite happily with volunteers and have people who don't have any particular need, you know, tennis clubs, church clubs, all those things. This is really trying to focus on those where there are additional costs because of vulnerabilities. Quite often those costs are around salaries, so I put that in.
Ted, I wonder if we should go back to hospices again, because I see that Juliet mentioned her question about hospice support was day services in people's homes, which is, it sounds like that also might be considered almost primary care. I'm not sure. What do you think?
We're looking for group services where people come together. It might be in a venue, that might be that they go to trips, but we're not looking to fund anything that's in people's own home.
Or I may have misunderstood that, Juliet. Did you say day services? Sorry. Let's have a look. Not in people's homes, in the community. Beg your pardon, Juliet. Thank you. I've seen that. Anthony says, how is the grant affected with service of volunteers and staff? We'll take into account all of your costings.
Yes, so there might be some cost to managing volunteers in terms of DBS, vetting, travel. Obviously, the more volunteers you can call in, the lower your overall cost will be, and that's very welcome, and perhaps the more people you can help. So again, if you've got a 100% volunteer run service, but you have some other costs you'd like us to try and help with, then do put in a bid. You don't have to have any paid staff. I hope that helps.
So the important thing is going to be obviously the quality of the service and meeting the criteria. Decisions are not going to be based simply on cost, are they, Ted?
Yeah. Yeah. So one from Fred, I'm making and adapting equipment by disabled people. That's probably not the sort of thing the grant's designed for, but I'm sure Helen would like to talk to you about other grant sources.
Yes, definitely have a look at our other grants. I'd say we have funded that sort of work in the past on our webpage, our grants page.
Probably not under that route unless it's a sort of group of people coming together to do some activities, group of people coming together to make the stuff, but we're really looking at sort of recipients meeting in groups. Another question about indirect costs like overheads. Yes, they can be costed in reasonable management oversight, some of the back office stuff like health and safety and HR and insurance. Do let us know about that, and that again might be quite different because of these groups who have specific needs than what it would be for an organisation for what you might call fit people, for want of a better word.
And thank you to Kate for her note about St Albans Old People's Trust having grants, small grants available for people in that area.
Yeah, lots of things out there. Some of our county councillors have grants available, district councillors and district councils may have grants. So if we can't help, others might. If you've got some grant funding from elsewhere, that doesn't mean you can't apply, but certainly would need to know about it. So if you can say we've got a lump sum from the lottery, but we need a little bit more from you, that's absolutely fine. But we'd want to know about it. This isn't one of those rounds where you have to be completely not funded from elsewhere.
Thank you.
In the course of the 2 to 3 years, you might be able to, lucky enough to get some sort of grant funding to do something extra. Just keep us in the loop.
Question from Alan Holmes about indirect costs. Yes, some of those are appropriate. It's all detailed in the guidance notes. Modest contributions to overheads is how it's expressed, with insurance being one of the examples given. Any staff costs relating to the admin or evaluation as well of the grant is appropriate. Health and safety, definitely. Management, all of those things. What else have we got? Any other questions unanswered? Let's have a look. If you think of something afterwards, of course, you can email grants@ and have a look at our FAQs. So don't worry if you've missed. If you think of something, especially when you start filling in the application form, I'm sure there'll be plenty of questions.
It's probably best if you email the grants@ email. Some of you might have my email, you might have Tracy's email, but it'll probably get a bit confusing if you ask us questions. We won't ignore them, but if you can aim to put them all through that route through HCF, it means we can improve our FAQs and we'll all know what's been asked.
Yes, and we'll get answers from Ted's team as well when necessary.
Yeah.
What else have we got?
We'll still be answering, but we'll know who's asked what.
Anybody else? Oh, more Q&As in the Q&A section.
So,
John, oh yes, after you.
Sorry, I meant to look this up. I think as I say, it won't be any less. We hope it'll be more. Better not commit at this point, but it's everything we've got, plus anything else we can scrape in. Still arguing for more, so I don't want to undermine that argument at this point. I think there will be a large call, which is why we may have to talk to people about whether we can manage their full grant. And there may be some changes for people who already get grants. We really need to make it fair, and what we're contracting for at the moment, whilst brilliant, is not very even across the county nor across client groups. So sorry, bit of a politician's answer.
Ooh. Anything else? Just trying to think of some nice examples. People can, oops, sorry, lost the slides again. Beg your pardon. Still, if anybody would like a quick whiz through the slides again, I'm more than happy. Sources of data. I think that's one of the slides I fudged a bit, but this information is also in the guidance notes, so it will be quite useful. Here we go. But as I say, don't hesitate to get in touch with us for any information before you start getting stuck. And we're evolving with our FAQs. And also we do know a lot of other sources of grants if actually this isn't the one for you. If you're new to this.
So there's a new question. Will geographical and other changes be implemented overnight on the 1st to the 4th, 22nd, or will there be a transition to allow services to scale up and scale down? So yeah, we're hoping to let you know before Christmas. So there'll be those 3 months to start to make changes. So it shouldn't be a big bang on the 1st of April. That might affect your costs during those 3 months. You come and talk to us about that. But you ought to be getting service users used to what's going to happen on the 1st of April from the 1st of January. Services will have those 3 months to get things moving to what they need to do if they need to book different venues or recruit people or look at changes.
Well, we've got 10 minutes left. Any more questions?
And I suppose in terms of that change on 1st of April, if you're starting something new or doing things in a new way, we'll obviously understand that you may not be up to full numbers on day one. There'll be some building up the brand or the service.
Oh, and Ted, you did mention, didn't you, how people might segue in from COVID restrictions and have a different number of people to start with if they're still following particular guidelines and build up.
Yes, let us know how that will affect your costs. So you might have to have two spreadsheets, one perhaps the 1 meter distancing if we're still there at that point, and one when you're sort of totally back up to normal. And factored into that might be the fact that not everyone's yet confident about coming out and meeting in groups, but hopefully they'll return to confidence. Question about monitoring requirements. Helen?
Well, from our point of view, we will have a light of touch 6 months check-in with you. And then at the end of the first year, before the end of the first year, if you're successful, you'll get 1 year's grant up front at the time. If you're and then at the end of the first year, towards the end of the first year, see how you're getting on. And you need to submit your monitoring for us to be happy that you can then get your second year of the grant. My understanding is that the HCC quarterly figures required are changing. On the guidance notes, there's the original example of what was required directly in terms of demographic data straight to HCC. But Ted, you can update us, because I think that's changing a bit, isn't it?
We'll try and make it as easy as reasonable. We will want some sort of demography to know that you're reaching different parts of the community. We'll want that sort of outcomes measures that you'll set out in your bids. We won't be coming around inspecting in, I don't know where we haven't done that for several years. If any of you have sort of history of having an inspection day and having to find everything at one point, it'll be like that. But we will just sort of keep communication open and check how you're doing. And you will need to sort of keep registers so we know how many people you're seeing, not necessarily names, but.
That's a really good question from Kate about gaps in provision. I mean, in broad terms, we've got our needs analysis and the results of our COVID surveys, which highlight what's been exacerbated by the pandemic. And some of that is geographical. In terms of something more concrete, in terms of mapping, I suppose TED's needs analysis will also, your links will also be helpful. But up front, underrepresented groups is I'd say an obvious target, but you need to know who they are and where, don't you, to have a clear answer. Ted, have you got any thoughts on this?
A lot of that should be in that research, and that's not the be all and end all of research, local knowledge that we don't have. I'll turn it around really that the services need to tell us what's missing, because there's sort of so many things out there. One specific sort of model that we're interested in developing is services that have people from different client groups coming together, perhaps around a particular interest. So in the past, I may have said, well, why not have a group for people who are interested in football or craft or handiworks, which is not specific to learning disabilities or physical disabilities or older adults, but it's for anyone who's interested in that sort of thing. That feels like something that's quite useful in terms of people having a hook into their community and a chance to meet people other than the people they normally meet.
I'm thinking of Men in Sheds for a start. That's the old example, isn't it?
Yeah.
Kind of thing. Gardening's another one, isn't it? Horticulture.
Yes, and we've had some examples there where people from different sort of client groups or service groups have been able to join in, work positively together. No, we never said that these things don't have to be indoors, they can be outdoors. Or mixture there. Or...
Well,
Yeah, maybe it for now. But as you say, as soon as you start putting pen to paper, more questions.
Yes. Well, there's another one. Is there another one? No. Oh. No. So we look forward to hearing from you.
Yep, thank you all for your time this morning. Some really useful questions and relevant stuff. So useful to us too. And all the very best. As I say, don't go away thinking not for us without having checked. Brilliant.
Thank you.
Thank you all.
Thank you. Bye.
Thank you.